Over the last year, we've had many ups and downs with COVID. Avera has seen over 5,000 hospitalizations and over 500 deaths related to COVID. These peaked in November and fortunately started coming back down pretty steadily throughout December and January, just in time for us to shift some workers from caring for patients in the hospital to getting folks vaccinated. Our vaccination efforts across our region have been going splendidly. We are way ahead of where we thought we would be on the number of people that are vaccinated at this point. We have over 30% of the population in our region that have had at least one dose of vaccination at this time. Numbers continued to decrease through the early spring, and we were all starting to feel pretty good that we were well on our way back to normal. However, we have seen a disturbing trend now in the last several weeks. Hospitalizations have now again doubled from their low in early March, and we see case rates continuing to rise again. This is likely due to several factors. First off, we are seeing variants that are coming into our region. Variants are mutations of the spike protein, those outer part of the virus that allow it to spread faster and potentially even be more severe illness. We are seeing that the UK variant particularly is becoming the dominant strain in our area. Even more concerning, we are seeing sporadic cases of South African variant and the new California variant as well come in, which have some partial escape from immunity and need even higher concentrations of antibodies to be able to successfully fight them off. Currently across the Avera's system, we have about 40 individuals that are hospitalized. We dropped down to a low of about 17 in early March. We've had over 5,000 individuals that we've monitored at home in addition to the 5,000 hospitalizations we've had, including at several hundred at one time that we've had on home oxygen. We are such a great place compared to where we'd been a few years ago. If this had happened, we were unable to monitor these patients at home with all the telemedicine capability that we have now. We would have had to hospitalize those individuals, and that would have made this whole situation so much worse. So the data is showing that COVID vaccination reduces the likelihood you can spread it to others. It does not eliminate it. So it's still important to continue masking efforts in public, because you never know who has not been vaccinated or who might be immunosuppressed that you could still spread this disease. And we're seeing it spread faster again. So it's still important when you're in public to continue those efforts. Together, we can win this and beat back COVID once again.
And if we want to get back to normal, I mean, when people can get that vaccine and have that opportunity to do so, why is it so important they do that?
Yeah, we all want to get back to normal just as quickly as possible. And we saw signs of that. The CDC started relaxing some of the regulations, started allowing vaccinated individuals to start coming together. So we saw signs of opening back up. Now with the variants coming, I don't anticipate we'll see further opening until we can get those variants back under control again. And the only way we're going to do that is to get even more people vaccinated and get up to that herd immunity concept.